Everyone. Um, well, again, good morning. Oh, I'm sorry, it's not even the morning, it's the afternoon. I'm sorry. Good afternoon, everyone. The LeCat Center is proud of Louisiana's scientific response to the COVID-19 pandemic. Researchers from around the state are working on the front lines, conducting research to improve testing, surveillance, health impacts, and treatment. As a resource to all scientists, clinicians, and citizens, we have launched the Louisiana COVID-19 Chronicle Seminar Series. Started in October of 2020, the LeCat Center is hosting a virtual reoccurring COVID-19 seminar series featuring scientists and clinicians showcasing the work being done right here in Louisiana in the battle against COVID-19. Topics and speakers for each seminar are announced to the LeCat's email list, calendar of events page, and Twitter as they are finalized. We want to congratulate the researchers who have been successful in contributing to our knowledge on COVID-19 and hope you will join us for future episodes of LeCat Center's Louisiana COVID-19 Chronicle Seminar Series. So today, during the presentation, please type in your questions in the chat window. We're going to save some time at the end to share your questions with today's speaker. And today's speaker is Dr. Kathryne Gwizdala. She received her Bachelor of Science in Neuroscience from Michigan State University in 2015 and went on to earn her PhD in kinesiology with a focus in cognitive and motor neuroscience from Michigan State University in 2019. She's been a postdoctoral fellow at the Pennington Biomedical Research Center since 2020 under the guidance of Dr. Owen Carmichael and myself. Her main research focus investigates insulin signaling in the brain and its relationship with metabolic diseases, specifically working on developing targeted clinical health interventions for underrepresented and at-risk populations. Previously, she's worked with Down syndrome children, and her current underrepresented population is older African Americans. Today, Katie's going to discuss the impact of COVID-19 pandemic on research participation among older African Americans. Without further ado, here is Dr. Kathryne Gwizdala.
Thank you for the great introduction, Rob. So yes, I'm going to go ahead and talk about the impact of COVID-19 pandemic on research participation among older African American adults today. COVID-19 is the newest face disparity for African Americans, with it being reported that they are 3 times more likely to contract the virus in comparison to whites. This population is also disproportionately at a higher risk for Alzheimer's, obesity, and diabetes, putting them in a higher risk group for the virus. With age being a factor for disease risk, older African Americans fall into one of the highest risk groups for these diseases. Yet, African Americans have been long underrepresented in biomedical research. On the left-hand side of this slide is the US Census population of Chicago, Illinois. And on the right-hand side, we have a landmark Alzheimer's and aging disease study that began in 1997, conducted by the Rush Alzheimer's Disease Center, primarily located in Chicago, Illinois. And as you can see, 6% of African Americans are enrolled in the cohort in comparison to the 30% that reside in Chicago, Illinois. There are other cultural factors that possibly contribute to this lack of research participation, and that could be distrust of researchers, as well as reduced interest in participation, poor doctor to patient communication, and difficulty interpreting medical terminology. In addition to these factors, the newly faced COVID-19 pandemic has the possibility to aggravate existing and create new research participation barriers, such as limitations to transportation, heightened anxiety about the virus, and the lack of access or familiarity to technology as an alternative to face-to-face activities. Therefore, the rationale of this study was to address the research gap on the impact of COVID-19 on lifestyle factors and willingness to participate in research in older African Americans. Hopefully, this will enable researchers to adapt to recruitment practices in this new reality. Specifically, the purpose is about the impact of COVID-19 on lifestyle factors and the barriers and willingness to participate in online and in-person research. For the purpose of my presentation today, I'm going to be focusing on the barriers and willingness to participate in online and in-person research, as this information fills an important time-sensitive gap in the current literature on how to encourage research participation with this underrepresented population. If you're all interested about learning more about the COVID-19 impact on lifestyle barriers in African Americans, you can review some of the currently published literature. For recruitment, participants had to be 65 to 85-year-old and identify as African American. The company Forthright assisted us in recruitment through their nationwide database, and participants were randomly selected and notified via email or text to complete the survey for this study. The online survey itself was sent out to participants between January and February of this year. The survey consisted of three main sections. Background information that included participant characteristics as well as they reside in the United States. Research participation, broken down into participation, barriers, and willingness, and our impact on behavior change of COVID-19, which we're not going over today. We also had the structure. It was multiple choice, and they also had a chance to do free response questions as well. And what we'll cover today is the background information, the participant characteristics, research participation broken down into those three parts, and as well as some conclusions and possible steps forward with what we gained from this research. I'm going to go ahead and start with those participant characteristics. The sample itself was 54% female, and the mean age was around 70 years old. It was 38% married and mostly retired individuals. The sample was over 20% had $70,000 of income and above, and 42% had a college degree or more for education. Georgia, California, and Texas had the largest representation of participants with our nationwide sample, and our median per state was 8 participants. Now I'm going to dive into the research participation, prior, virtual, and in-person research. One of our first questions we asked was, have you ever participated in a research study before? And of the individuals who said that they participated in research, 63% said they participated online, and 37% that said that they participated in person. For our virtual research, we asked, would you be willing to participate in a research study using a video conferencing program? And 39% said that they would be willing to participate. And of that, we asked, what were the type of activities that you would be willing to participate in while doing virtual research? So we asked, would you exercise in a group, alone, discussion in a group, or one-on-one discussion, as would you be willing to be recorded virtually? And as you can see, the majority of participants, if they were willing to do virtual research participation, they were willing to do these variety of activities. For in-person research, we asked, would you be willing to regularly meet in person with groups of other people as part of a research study, as long as government guidelines for social distancing, face covering, and hand washing are followed by other participants and research staff? And 42% said they would be willing to participate in person research. This had a very similar trend to the virtual research in terms of individuals being willing to do a variety of activities, as well as even going to a YMCA to participate in this research. And we did ask about exercise, as that is one of the interventions that we often do with this group of individuals. In brief summary, most prior research was done online, and about 40% of older African Americans were willing to participate in research in general, and they were also willing to do a variety of activities, both virtually as well as in person. So the way that we assess barriers in this sample is through our free response questions. So we either had it where they answered a certain question and then they were prompted to elaborate on that answer, or we just had fully open-ended questions. And because there were so many people who answered to these open-ended free response questions, we thought that the best way to analyze the data was to create it into themes. So to briefly go through that process, we had two separate raters, and of those two separate raters, they separately generated keywords based off these participants' responses. And then they grouped them into unifying concepts that led us to our themes that emerged from the data. The two raters then got back together and consolidated the codebook in terms of discussing these themes that emerged from the data, as well as coming to a solution if there was any discrepancies with what they saw. Once that codebook was consolidated, then the whole data set itself was coded by a primary rater. And then these codes were checked by a separate rater for agreement. And again, any type of discrepancies were discussed and come to a solution before the final data was looked at. And as an important note here, participants, when they were prompted to answer these open-ended questions, we had a really good response rate in the fact that about 80 to 95% of the sample consistently answered to these responses. Starting with barriers to prior research participation, consistent with the previous literature, 68% or a majority of the sample who answered this question said they had not participated in prior research. And like I said before, individuals were provided with a space to explain why, and the following themes emerged. So we had logistical research barriers as a theme. And this referred to things such as transportation requirements or time requirements that might have prevented participation. So like one of the participants said on the slide, I have not qualified for the research previously. Another barrier that emerged was inadequate outreach. And this was defined in terms of spreading word to the community that the research opportunities exist. So as one of the participants said on the slide here, I was never afforded the opportunity. Another theme that emerged was lack of interest. And this was just simply that they had not been interested previously to participate in research. One of our final themes for barriers to prior research participation was mistrust in research. This is very consistent with the prior literature and came up with participants saying things like, I was asked once, however, I was afraid, or I just don't want to be being treated like a guinea pig. So then, like I said before, we had questions that were referring to future willingness to participate in future research participation. And our first type was virtual research participation, and 61% of the sample said, no, I'm not willing to participate in virtual. Then we had in-person research participation, and 58% of the sample said, no, I'm not willing to participate in in-person research participation. And they had separate spaces to explain why they were not willing to participate in virtual or in-person research participation. And the following themes emerged from their responses. So we had a theme for logistical research barriers, and this was defined as referring to details that involve some sort of coordination or structure of the study that they could not participate in. So virtual, for this quote on the slide, says not having time to be able to participate, or in person, going back to our transportation piece. I have no transportation to be able to get there. Another theme that emerged was psychological research barriers. And this was defined as describing some sort of mental obstacle that would impede or prevent research participation. And these quotes very much surrounded about worries about physical appearance, such as I have bad teeth and am self-conscious about them, or pointing out that I do very well in groups of people that I don't know. So they're not very comfortable around strangers. Our next theme that emerged was privacy and security concerns. And I have examples from the virtual question on the slide, but it did show up for virtual and in-person research. And this was statements surrounding fear and worry about the safety in terms of the use of their personal data and invasions of one's privacy. So like one of the participants said on the slide, that would be more exposure than I would want online. Now, this was a theme that just showed up for virtual research. And this was along the lines of unfamiliar with technology. So this is referring to a skill level or hesitancy toward using technology involved in virtual research. As one of the participants said, I'm not that computer savvy. Another theme that showed up just for virtual research was unreliable or missing equipment. And this was defined as needed equipment, such as a computer that they didn't have or didn't have consistent access to. So a really good example of this is at the bottom of the slide, this person said, because my laptop is my husband's work laptop. So they wouldn't have access to it all the time to be able to participate in virtual research. Now, this next theme here showed up just for in-person research, and this is COVID pandemic fears or restrictions. And this was defined as describing fears or recommended rules related to COVID-19 pandemic that would prevent somebody from participating in research in person. And so, just like it says on the slide, not until the pandemic's over, or maybe referring to more of the restriction piece, I'm not going to mingle with anyone other than immediate members of my household. Another theme that showed up just for in-person was underlying health issues. And this was referring to some sort of medical problem that the individual had that would prevent them from participating. So as another person said, my immune system is challenged, so they really wouldn't be able to participate. In summary here, the emerging themes confirmed pre-existing barriers in the literature, as well as identifying novel COVID-19 research barriers to participation. And lastly, for research participation portion, I'm going to talk about the willingness to engage in virtual and in-person research. And the first thing I'm going to touch on here is about accessibility to technology to be able to participate in this research. 95% of our sample reported that they had access to Wi-Fi at home, and of the individuals who did not, they had access to Wi-Fi elsewhere. 89% of our sample reported that they owned a smartphone, and 78% reported using internet on their smartphone. Finally, 92% said that they owned a computer, and 67% of them said that they had a camera to go along with this computer. So in terms of technology accessibility, these individuals would have access to technology to enable them to participate in COVID-19 safe activities in their own home. Then I went on to ask about, what would make you feel more confident to participate in research? So for virtual, we had what would make you feel more confident in participating in research study using a video conferencing program. And for in-person, we asked what would make you feel more confident in meeting in person with groups of other people as part of a research study. They provided just completely open-ended space for these individuals to answer, and the following themes emerged for their willingness to participate in research. So we had a theme going back to the logistics of the study, and both virtual and in-person talked about needing more specific information about the study in general. But as you can see for virtual, one person said, I've heard of Zoom and webcam, however, I don't have a webcam and I've never used Zoom. I'm sure I could learn. So more toward the education of being able to use this technology. For in-person, I have no problem meeting with a group or in person if it's in a close location. So going back to transportation for in-person research. Another theme that emerged was welcoming environment. And the example on the slide is just for in person, but we did have it show up for virtual research as well. And this was defined as referring to the need for certain details of research participation to make the participant feel more comfortable engaging. And this definitely surrounded just being in that welcoming environment and not, like this person says on the slide here, not being laughed or scorned at because of their physical appearance. Another thing that showed up, and this showed up solely just for virtual research, was meaningful research in their community. So this was defined as stating that their research participation will in some way help or improve life for their friends or community. Stating quotes like, "This study will result in something meaningful." And our security and privacy assurance theme showed up here. And this described the need for personal information to be used properly and protected. And the example on the slide here is for virtual, but it showed up for both virtual and in person. And like things like the degree to which personally identified data will be protected, or if I was assured it was a secure connection. Solely for in-person research, the theme that emerged was pandemic being controlled or gone. So back to quotes like, pandemic, I'll only become comfortable after the pandemic is over, or referring to more of the lessening of regulation side, where until I hear we don't need to use a mask or worry about social distancing, I would not be comfortable in an in-person group. And this last theme here, following COVID-19 health guidelines, was just for in-person as well. And these are CDC guidelines that we've heard throughout this entire pandemic, wearing masks, being social distance, but a participant even mentioned COVID-19 testing documentation for each participant. In summary, these themes that emerge identified research barriers that can be overcome for this population, as well as highlighting the needed dissemination of information, as well as transparency and safety practices to enable participation. Considering what these themes revealed about these barriers, as well as the willingness to engage in research for this population, I would like to cover some steps we could take forward with this knowledge, as well as review the strengths and limitations of the study, and at the end, some overall conclusions. So starting with the known barriers and what we've seen in the prior literature, these themes definitely confirmed some of these barriers here, but we still need some work toward overcoming them. So one of the top ones that kept showing up was, it being in a close location or needing some sort of transportation because they don't have a car. So maybe we think about something less traditional through providing stipends for using Uber or Lyft instead of having them rely on public transportation, especially right now in the pandemic. Another one was inadequate outreach to say, hey, these research participation opportunities are here. And this could possibly be a start in terms of maybe creating some sort of community board with prominent members from the community, or just general members from the community in general, to discuss the needs beyond just forming barriers for, beyond just forming relationships for recruitment. Now, we also have some new novel barriers in regards to the COVID-19 pandemic. And I know you're all probably thinking, well, these seem pretty common sense here. But as far as we know, no one has formally assessed these barriers in a study yet, and especially for this population of older African-American adults. So the top one here is definitely following COVID-19 health guidelines, but also taking the extra measure to make it well known to the community the measures that the institution is taking. So along the lines of just being completely transparent and making sure that they have the best welcoming environment that they could have to come and participate in. Also being transparent about data protection practices, maybe going above and beyond what we typically put in the consent form, because of the fact that we're moving to a lot of online interventions due to the pandemic right now and safety measures. And then the final step that I'll touch on is technology access and training for online interventions. So in terms of access, maybe providing the needed equipment, such as cameras or Wi-Fi hotspots to have more reliable Wi-Fi while they're participating, as well as providing workshops to the community to be able to use these video conferencing softwares or other useful softwares that might help them in their daily lives. Now, it is important to note that this study had strengths and limitations. It was a nationwide sample of older African American adults, and it did provide new insights on the COVID-19 research barriers. However, it was only deployed for a short amount of time, so it reflects opinions and perspectives at the moment these individuals took the survey. And it also may not be fully representative, even though it's nationwide, because we did have a few states missing from our data. In conclusion, this tells us that older African Americans face new research barriers due to the COVID-19 pandemic. These barriers can be overcome through steps such as transparency about the data use to provide the needed resources. And the overall goal here is that this will ensure that previous efforts to encourage engagement are not reversed by the pandemic. And I just wanted to say a quick thank you to my mentors, as well as my amazing collaborators and the Bright Focus Foundation for the funding to do this study. Thank you all for coming today and listening, and I will now take any questions.
Thank you very much, Katie, for an informative presentation about the effects of COVID in an older African American population. So now we can field any questions. I'm going to start with questions that are in the chat, and then once we go through those questions, then we will field any questions from folks who want to get online, unmute themselves and ask a question. So we have a question from Paul Fidel, and he's asking, did you run any nested analyses on those with less education or lower socioeconomic status?
So that's a great question. I did run a few analyses kind of looking at those dichotomous groups, and as far as I saw, I didn't really see any significant differences with that.
Okay. I'm not seeing any more questions in the chat. So anybody who wants to unmute themselves and ask a question, now's the time.
Yes, this is Margarita. How are you doing?
Pretty good. How are you?
I'm fine, thanks. So I don't recall very well how many total participants you have.
624 participants.
Okay, and you recruit them using these online public services?
Sorry, would you repeat that?
How do you recruit these participants?
How do we recruit them?
Oh, how do we recruitment? Sorry. Thank you, Rob. So the way that we recruited these participants was through the Forthright company, and they had a nationwide database that they curated through web advertisements, mailing advertisements and things, and social media, things like that, where they just in general have a wide base of individuals that participate in surveys from the company. And then we talked with Forthright about our specific criteria in which we wanted, and then we took a random, based off of the participants that they had in their nationwide database, they took a random sample from their database that they had and invited them to participate, and that's how we recruited from there.
So in total, how many people were invited? I would like to know the response rates, response rate of this.
Yeah, that's a great question. I don't really know off the top of my head in terms of the response rates, but I do know in general that pretty much if they asked these individuals to participate, they usually filled out the whole survey. There usually wasn't what individuals who only filled out part of it or clicked on it and then didn't do it. But I don't, offhand, I don't have the numbers for in terms of like how many people they actually reached out to.
That
the
is
people
very
who completed it.
important because this is a national survey. And I don't recall very well, but I think that there were some states that have more participation than the others. So it could be a little bias in the presentation. So perhaps in the limitations, you need to have, or if you can get more information about how many people were invited by state and see. And also another question is, I understood that the data collection was online. So I received an email, they invite me to participate and I answered the question online. Is that correct?
Yeah, that is correct.
So that is totally biased already because all this, your research is all conducted online. So all your participants already are registered as a possible participants or research because these are public databases that they build. So everybody who is registered in those databases is already willing to participate in research. First. Second, all these people already have computers and have the information on how to answer the questions online. So, and additionally, the demographics that you show, most of them have high level of education and also high level income. That means that they afford to have computers, internet, and also education to answer all these questions online. So this is a huge limitation in your research, again, because all your participants are already willing to participate in online research. So I will recommend you to put that in your limitations.
Okay, thank you for your comments on that.
Okay, so there's no more questions in the chat. Does anybody else have any other questions or thoughts on Dr. Gwizdala's presentation?
This was very important and I really appreciate you doing this. It called my attention because I am already working with research with African-American men here in Louisiana. Originally, my protocol was all in-person meetings, but because of COVID, we had to change everything to online. So I really appreciate that you are doing this research because I have personally noticed that in general, my participants prefer to meet in person, but they do not want to drive. And sometimes it's not that they do not have a car, that the limitation of transportation is not that they don't have a car to drive, it's that they do not want to drive 1 hour because it's just also the time to get to the appointments. And I have seen personally that they prefer to use their iPhones, that the laptops. Most of my participants do not have computers at home. They do everything on their smartphones. So when you are doing data collection or doing research using smartphones, you have to be very aware about how long the questions are, how many options, because it's much difficult to answer all these surveys using the phone than using the laptop. And that is one of the main constraints or the barriers we have found in my study. So I really appreciate and congratulate you for doing this job. Thank you.
Yeah, thank you.
So that's a very interesting component in that we, that you're experiencing that COVID is altering your research strategies, and we've experienced the same sort of thing in that we've had to alter where we do some of our intervention work because of COVID and because of protections. Are there other folks on, who are listening in today who have had a similar experience where their research has been altered because of COVID? Or are people collecting data similar to what Dr. Gwizdala collected in terms of the impact of COVID on a particular population?
It seems that it's only me.
Well, no, it's me too. I mean, so
Okay.
we have we had a study that we were doing. It was in person, and it was going to be conducted at the YMCA's around Baton Rouge. And then COVID hit, so we sort of had to pause a lot of our activities because we weren't sure exactly how to go about protecting folks and if people would be comfortable doing in-person research with everything that was going on with COVID and the increased risk that our particular population, which is older African Americans, would, they're at higher risk. And so we were really concerned, doubly concerned, I guess, that they would be fearful of coming out and doing in-person research. And so we were going to be doing things in the YMCA, but then we investigated some of the YMCA's and we found that they were not being very strict with their rules concerning wearing masks, social distancing, and those kinds of things. And so then we decided to move our intervention to the institution where we could have more control over these things in terms of making sure that we have social distance, making sure that everybody has a face mask or face shield, that we can put up barriers in between participants, that we can space folks out 6 to 10 feet, limiting the number of folks who are inside of a room, making sure that we are pushing through enough air in the environment so that, that would meet the COVID standards. So our research was significantly disrupted because this was supposed to be a community-based intervention, and now it's more of a, although Pennington is in the community, it's more of an institution-based kind of intervention now, as opposed to what it was. So certainly, Dr. Echeverria, just like you, we've had to make some alterations. We decided not to go with with a remote, because we felt like the group component was really necessary to our intervention. And so using remote, we just felt like that wasn't going to really provide as much of a group interaction as what we had originally planned in the grant. So in order to stay true to the grant, we modified the location, but not the actual intervention. So, we've had things altered, and you've had, things altered, and I'm sure that there's other investigators who have had similar experiences.
And now I have another question. Sorry again. So I imagine that I imagine you have an IRB, did you?
IRB, yes.
Yeah.
Okay. And I imagine the consent to participate is just implicit. So I click to answer the survey, and that is my implicit consent. Or how did you do?
No, they were shown a consent form, like a brief consent form in the beginning. Like
So
it wasn't, yeah.
Electronic signature?
Yeah.
Yes. So so Forthright basically used like SignX or what's the other company? I'm blanking on the name, but it was online.
DocuSign.
DocuSign, yeah.
Yeah.
Yeah. So it was online consenting.
Yeah.
So they had to know also how to sign the consent.
Mm-hmm.
And you can, in the IRB, they accepted that you just having signatures, electronic signatures?
Yeah. So we have several studies that are going on that are using electronic signatures, and those are going through the IRB. At this point in time, there's no real hangups from the IRB about using electronic signatures and online consenting.
Yeah, I know about that. And I understood also that you are giving an incentive to participate. How much was that?
Yeah, so They were entered into a lottery, and I think it was 10 people had a chance to get, $50.
That's good. That's good.
Mhm.
I imagine those $50 were electronic gift cards. Is that right?
Say again?
I imagine that the incentive were electronic gift cards.
No, it's just money. It's not gift cards.
So how did you give the money to them?
So what would happen, like in terms of, they were randomly selected, and then Forthright would send us their contact information, and then like we would set it up where we would get the money to them that way.
Wow. So you mail a check?
I essentially, you could call it that.
Yeah, 2021, we're still mailing out checks from LSU.
That's very interesting. Yeah, because now there is a lot of ways, because that is one of the important points when you are conducting research online. That is the topic, no? The different barriers of doing research online or in person. In person, you just give them the cash or the incentive, whatever, directly when they finish the meeting. But online, you have to do an electronic gift card or incentive, or you have to mail it. And sometimes they don't trust that the check is gonna get in the mail. So that is another interesting barrier that we have considered.
Yeah, I mean, it also depends on the institution too. I know that at some institutions you can give them the money directly after the session, but I know here at Pennington that it still takes a little while for them to get their incentive at the end as well. So I guess it kind of varies from institution to institution.
Yeah, that's interesting. We implemented electronic gift cards. So it's much easier because we have the control. We know that they claim the gift card and also use the gift card.
Yes,
Mhm.
using like Clint cards.
Yeah, the clean cards, for example. Yeah.
Yep.
Very interesting. Thank you again.
Mhm.
All right, are there any other thoughts, feedback? Anybody else want to share research experiences with this population or the impact of COVID on your research? All right, well, hearing none and seeing that there's no more questions in the chat, then I want to thank everybody for taking time out to listen to Dr. Gwizdala's presentation. We hope that it has been informative for you. Should you have any questions, feel free to contact Dr. Gwizdala. She can be found at pbrc.edu. And we thank everybody for attending and look forward to seeing you next time.